Hey guys, Dr. Green here. Today we're going to talk about something that is very important to a lot of men, something that we get asked about every day in clinic, and that's penile shortening, how to maximize penile length. Specifically before penile implant, but this doesn't have to apply just to people before surgery. This can apply to just men with erectile dysfunction or men who have noticed penile shortening as they've gotten older. Penile shortening is a very common thing that does happen with men with erectile dysfunction, so let's get into it. Okay, so starting off, I want to get into a little bit about the why. Why does penile shortening happen, especially in men with erectile dysfunction? And there's several reasons. The first reason is you're not getting that expansion that you would when you were getting normal erections. So when you were younger, in your 20s, teenage years, even throughout the night, you're getting multiple erections. Throughout the day, you're getting multiple erections. Just those erections are working to expand the tissue, and just that general expansion is helping keep all that tissue elastic and give you that good expansion of length that you expect. Now, as you get older, if you're not getting all that expansion all the time that you were when you were younger, those tissues are going to get a little less elastic, a little bit more stiff. And that means even if you get an erection, they may not expand as much as they did when you were younger. So we're going to work to combat that a little bit. Now, another thing that can happen is that the tissue is just not getting the oxygenation it needs or the blood flow that it needs to maintain a healthy tissue. And that happens as you get older. That happens as you have erectile dysfunction. The blood flow is not as good to the penis. Just like with the elasticity, when you're younger, you're getting erections throughout the night, you're getting erections throughout the day. That is increasing the blood flow to your penis and keeping all that tissue healthy. Over time, as the blood flow is not as sufficient as it was when you were younger, that tissue starts to do what we call atrophy. And that means the tissue starts to actually kind of break down a little bit. And that can lead to penile shortening as well by causing any scar tissue or just inelasticity as well. Now, the third option that can happen is something like Peyronie's disease, where you actually get scar tissue in the penis. That can be partially related. However, that's normally what we think the cause of that is because of kind of micro traumas over time building up and causing scar tissue. And that scar tissue can tether the penis down and decrease the length and increase penile shortening. So those are really the three main theories of why the penis can shorten over time. As the erectile dysfunction worsens, you can expect the penile shrinkage to worsen as well. And that's just something you're going to see over time with erectile dysfunction. But let's go over how we can combat that, help to increase your penile size, help to decrease the rate of penile shortening. I'm not saying that you're going to get back to where you were when you were 20. That's pretty unrealistic, but we can hopefully get you a few centimeters back, hopefully get it to where you're not continuously having shortening. And especially if you're undergoing penile implant surgery, hopefully get it to where for that 6 weeks to 8 weeks before surgery, if you do these things, we get you the maximum length we possibly can. All right, so let's go over several things you can do to decrease your rate of penile shortening and hopefully gain back a little bit of length that you didn't have before. Now, the first thing and probably the most important thing you can do is get a vacuum pump. And this is just a fairly cheap vacuum pump. I think this is about $100. You can get them way cheaper than this. You can also get them more expensive. You can get electronic pumps. This is just a manual pump that you basically put around the penis. You put your penis inside. You pump this up several times. It pulls the blood into the penis, and then it can hold the blood into the penis if you leave it on. And once you're done, you just take it off. The blood kind of comes out of the penis. Now, the way this works is it increases blood flow to the penis, but it also provides that mechanical stretching that you got when you were younger and getting really firm erections. So what I tell everybody to do, everybody who's at least going under penile implant surgery, everybody who's worried about penile shortening, or even just rehabilitation if you have mild erectile dysfunction, don't want it to get any worse, or don't want to lose more penile size, get a vacuum pump. This is the number one thing that you can do. And some people will use it for intercourse. To do that, you have to put a ring around the penis to hold the blood into the penis. However, most people don't really find that satisfactory. They kind of found it uncomfortable that I've seen. So get it just for exercise and rehabilitation. The way that I tell people to use it, put your penis inside, pump it up. So give it several pumps until your penis gets hard, and then hold it there for 30 seconds. And do that 5 times in a row. So pump it up, hold it there for 30 seconds, push the button to release the suction, let it down, pump it up, hold it there for 30 seconds, push the red button, let it down. Do that 5 times in a row, at least once or twice a day. The more times the better. If you can do it twice a day, even better. But if you can only do it once a day, that's good as well. And the way that this works is it provides that mechanical stretching to hopefully give you some elasticity back for your erections, but it also provides blood flow to the penis, and that's also just as important as that elasticity. Okay, number 2. The other thing that you can do to help decrease the rate of penile shortening and hopefully get a little bit of length back, in addition to the vacuum pump, because I still think that's the most important thing that you can do. Take a daily small dose of an oral PDE5 inhibitor medication. That's like your Viagra, your Cialis, your Tadalafil, Sildenafil. Take a daily small dose of that medication. So if you're taking Tadalafil, take 5 milligrams every single day. You can take a booster dose if you need to have intercourse up to 20 milligrams in a 24-hour period. But again, talk to your doctor if your heart is healthy enough for that, or if you have any side effects with that. But that, in conjunction with a vacuum pump, increases blood flow to the penis. Those medications help to increase the arteries that feed the penis with blood. Increasing the size of those arteries increases blood flow to the penis, and again, helps to keep the tissue healthy, prevent shortening from happening more, prevent that scar tissue, prevent that atrophy of those cells from happening over time. Now, those first 2 points are something that I tell every single person who comes in here thinking about the penile implant that they should do immediately before their penile implant. And that's because I believe that those are the 2 things that are going to increase your length and give you the best result after penile implant surgery. The other things that we're going to talk about are things that you can do, but may or may not help, just depending on the person. And the third thing is an actual traction device. And a traction device is something that you actually put your penis in, and it pulls the penis or bends the penis. This is most helpful in men who have Peyronie's disease or a curvature. This can actually help to decrease that curvature over time and give you a little bit more length in the penis, especially if you're thinking about penile implant surgery or just in general. This can decrease that curvature and give you a little bit of length back. Now, it's not something that happens overnight. This is something you're going to have to wear twice a day for months to actually see results. And it's not going to be, you're not going to go from a 45-degree curvature to a 0-degree curvature. That's just unrealistic. However, it will give you some relief of the curvature, and it will give you some of that length back. And finally, the last thing that you can do really to prevent penile shortening, prevent the shortening from getting worse over time, is to actually just get the penile implant. That penile implant takes up the space inside of the penis, takes up that corporal cylinder space, because those cylinders sit inside the penis. So over time, as long as you keep cycling that penile implant, you're not going to get that shortening, because that's going to keep the tissue well expanded. So as the penile implant's in there, you're not going to continue to get penile shortening. So the penile implant can actually be a cure for shortening penis. It's not going to give you more length than what you have. We can really only give you what you got. So a lot of times that's not the same as when you were 20. Now, if you do those other techniques like the vacuum pump, the pills, that can help you get closer to where you were. I'm never going to be able to get you back to when you were 20s or 30s. I'm not going to be able to get you back to that length, most likely. However, doing these things can improve your chance of having the longest possible penis that you can have with the penile implant. And when we do the surgery for penile implant, we do gently oversize it. We do measure it on stretch. We do give you an artificial erection prior to the surgery so that we are able to get the maximum expansion that we possibly can. And then once that implant's in there, you're not going to get shortening from that point on, just because that space is really taken up by those cylinders. So once you get the penile implant, you don't really have to worry about shortening anymore. All right, guys, I hope you found the video informational. Thank you for making it to the end of the video. Remember the 2 main things that you can do to decrease penile shortening and maybe even gain back a little bit of penile length. Number 1, a vacuum pump. I believe that's the most important. Then number 2, taking those pills, sildenafil, tadalafil, those pills that increase blood flow down to the penis, just taking a small dose every single day to increase that blood flow and prevent penile shortening. If you guys have any comments at all or any questions, I'll try and get to them. Just leave them in the comments down below. Thank you guys for watching.